It's open enrollment season for both workers and retirees. With plans changing, CBS News business analyst Jill Schlesinger is here to help guide us through the process. Jill, more than 150 million Americans purchase health insurance through their jobs. Where should they start?
I hear them groaning as we start this segment, don't you? I think that it's a big mistake to just choose what you did last year, right? So start with a list of your doctors for you, your family, and all the prescriptions. And you just want to make sure, is everything still covered under my current plan? Now, if it is, maybe you stick with that plan. But I also encourage people to take a good, long, hard look at a high deductible health plan. More and more companies are offering these. These are plans that offer lower annual premiums in exchange for higher deductibles. Now, to pay for that higher deductible, you get to pair a high deductible health plan with something called a health savings account. These are amazing because the money that goes into an HSA, it goes in pre-tax. The earnings inside of the HSA, no tax. When you pull the money out, and whenever that could be, it could be years, it could be decades in the future, no tax due. So it's a very good way to save for health care over time.
It's also open enrollment for Medicare. What should folks over 65 know?
I think more so even than your employer-based plans, Medicare plans change every year. There are insurance that just pull out. They can change the scope of their benefits, their cost sharing, the services. So you really need to focus on the process because it really could save you a lot of money next year.
Open enrollment for the Affordable Care Act opens on November 1st. What's expected for those costs next year?
You know, more than 24 million people are covered by the Affordable Care Act. And a lot of those people get help paying for their health insurance through tax credits. Well, the government shutdown is actually the battle over the larger tax credits that were enacted under the Biden administration. They're called the Enhanced Premium Tax Credits. So these are all expected to expire at the end of the year, these bigger tax credits. And if they do, I think a lot of Affordable Care Act enrollees are going to get a much smaller tax credit. Some might lose their eligibility altogether. So that would mean they not only lose a tax credit or get a smaller one, they also are going to actually have to be paying for higher premiums.
Jill, that is a lot of information and a lot to absorb. Thank you so much. You can see Jill regularly on CBS Mornings and the CBS Evening News. For more analysis, go to JillOnMoney.com.